In this episode on the Therapy Dogs Australia podcast, we got to sit down with the lovely Ash Montgomery from Golden Thread Therapy. Ash offers people-centered counselling alongside Beanie, her divine therapy dog. Ash and Beanie did their training with Therapy Dogs Australia, so we took a deep dive into discussing the unexpected challenges and lessons learned working as a therapy dog and handler team. You won't want to miss this one, so let's get into it. Hello everyone, welcome back to another episode with Therapy Dogs Australia. Today we have the lovely Ash Montgomery and Sam King.
Good morning.
Good morning. Ash, how about we start with you just introducing yourself for the listeners?
Of course. So I'm Ash. I work from Ash Grove in Brisbane. There's a lot of ashes involved here, aren't there? My business is called Golden Thread Therapy, and I work with my little golden retriever border collie mix. Well, she's asleep right now, but therapy dog Beanie. So the name's obviously a bit of a play on her golden retriever side, but also about, you know, the golden thread that sort of runs through every human and what is meaningful to them and what,
it's beautiful.
Their values directed stuff. Yeah.
That is so cool. Really, really cool.
And how long? So you've been working with Beanie for a year?
Yes, I'm just laughing because I can hear her wriggling around in the back here. Yeah, Beanie and I literally, it was so sweet last year. In July, I think it was, she became a qualified therapy dog the day that I became a registered counsellor, which was so sweet.
So much to celebrate.
Yeah,
we must have timed that perfectly.
I know, it was such
I must have
timing.
known.
I know, so strange. It was definitely a bigger deal for me that she got qualified that day because, you know, I kind of had the degree down by that point. But yeah, so we've both been around for the same time within this space. Almost a year.
Learning together.
Yeah, definitely.
Yeah. Oh, that's wonderful. And who do you work with, like your client base? Who do you mainly work with?
So I work with adults. Actually, I've got some older teenagers as well, but mainly adults, and mainly just different life things, relationship things, transitional stuff, identity stuff, and then also different mental illnesses like depression and anxiety, and working within collaborative teams on some other more severe things as well.
Oh, wonderful. Yeah. And how has that journey been with Beanie in particular? Like, obviously Beanie's been learning on the job with you in a lot of ways. What's her sort of like role usually?
I feel like I could talk about this for so long. Like, she just does so many different things. Like sometimes I feel like she's working harder than I am, which is really lovely. But then also there's times where she sleeps for like 20 minutes and I'm like, no, I'm pulling half the weight here. That's good. But she just creates such a lovely environment for people. And the more that I work with her, the more I realize how important that environment is in terms of people feeling safe, welcome. So many things. The way that she greets people is so sweet. And just, it always starts on such a warm level. And then throughout the session, there's just so many different dynamics that she'll bring to the table, whether it be providing people with that stress relief. You know, there's obviously, I learned from my clinical training with Therapy Dogs Australia that there's all these amazing stress relief impacts that dogs have, which I think a lot of us probably anecdotally knew anyway. But she, you know, I'll watch people get quite tense talking about hard things, obviously, because that's a big part of therapy. And I'll watch people just put their hand on her head and just be gently patting her, and it's so grounding for them. Or even it kind of gives a bit of agency back to clients as well to direct their sessions with me rather than just me taking them through things, because they will self-regulate sometimes. So sometimes they'll be talking about something really difficult, you know, getting a bit of regulation from being with Beanie on the couch. And she's just right there. So it's a really easy way for them to sort of like break the tension when they need to.
Mm.
And
Oh,
She's just jumped up on the couch behind Ash. We can all see each other.
yeah, very cozy over there. But yeah, it's just so lovely watching that happen. They'll sort of look at her and laugh about something that she's doing, or and
Like
then
we
find
just
that
did.
regulation that they need. Exactly, yeah. Which is
great
just
icebreaker as well.
definitely, yeah. So I feel like the bonding at the start of the therapy alliance is a lot faster, but in an ethical way, which is amazing. And yeah, just all of those different ups and downs within sessions. And I've had some people just outright say to me that there's no way they could have worked through some things if Beanie
Mm.
wasn't there. And they will literally, like, if she ever can't be around, they will not talk about certain things because
Wow.
she's
Yeah.
such a grounding presence for them. Yeah.
Oh, that's really wonderful. And
That's
it's
so
wonderful that you
cool.
have started that journey together at the same time as well. Like just a
Totally.
team from the start.
Yeah.
One of the things that we've learned about, you know, I think it might be in the ATL code of conduct around, you know, working within your scope and trying to be, you know, pretty proficient with your tools as a professional before you move into animal assisted therapy, which can be like definitely ideal in lots of scenarios. But I worked with Sunny throughout my provisional pathway as a psychologist as well, which was, you know, over 10 years ago now. So we didn't have a code of conduct or anything back then. But it was such a eye-opening journey for me. But it's hard for me to compare like what was it like without him, because I only worked without him for like a year as a provisional.
Oh, wow.
I
Yeah.
did the exact same thing. Yeah.
Yeah. And then I had him with me, and I've had I worked part-time, obviously, animal assisted therapy with him initially because I only have one dog at the time. But it didn't take me long to get a second dog trained. So from very early career, I've been doing animal assisted psychology, and it's very hard for me to compare to what it would be like without having them there. Apart from like, there are days when obviously, you know, the dogs can't be there for whatever reason. But I honestly couldn't really tell you. Like, I was never a psychologist without a dog, really, like for such a short period of time. But I can definitely see the benefits that I see. And I definitely, from talking to other psychologists that haven't worked with animals, definitely can see, you know, like a lot of things for me have been a lot of an easier journey. So you sound like you're
What
in a
sort
bit
of
of a
things,
similar
Sam, in
situation,
particular?
Ash.
Yeah,
What sort of things have been
definitely.
easier?
Yeah, in particular.
Yeah, so things like your KPIs, like some practices keep KPIs, which is like your retention rate, basically, is how they do it in the therapy industry. Because it's like, you know, to be able to be effective as a therapist, you need to be able to maintain engagement with the client. So they keep coming back for more sessions because otherwise, you know, the treatment's not complete, really. And it's like, you know, a lot of places you'll hear saying like it's the most important thing is that you're able to engage your clients and build that rapport and keep that engagement going throughout the treatment protocol, basically. My KPIs for retention were smashing every other senior
Amazing.
psychologists in the clinic that I was in. I remember they gave us our KPIs one day, and my average session thing was like 7 point something, and everyone else's was really low, like 2 point something.
Oh, whoa. Yeah.
Wow.
And I was a prov psych, and it was like,
Sort of like,
and I was
like,
like, oh, should I just like immediately leave because now everyone hates me? Like, and so not only was like, you know, that satisfaction of like, you know, I'm probably doing a pretty good job. Like I knew it was the dog, but also like my employer at the time is obviously happy with you. And
Of course. Yeah.
I think there was some, you know, between the colleagues, it was probably a little bit like, oh, this chick, like making us look like fools. But their numbers were very stable across each other. Like everyone else who didn't have a dog, like their numbers were very, very similar. But it just highlighted, like, you know, and then from there, like, I mean, far out from people that worked there, we must have trained another, since starting Therapy Dogs Australia, like 3 or 4 of their dogs from that workplace. So, you know, like it was obviously a cool exercise for people to see. But even that type of thing, like being early career and being, so quote unquote successful in that regard, like it's just less stressful for you because you have so much stress early career. We get this thing called imposter bias, where it's like, or imposter syndrome, where it's like you just feel like you don't know anything, and all this knowledge that you have as a therapist becomes quite implicit, a lot of it. So because you're pulling from all these different toolkits, and it feels like you're making stuff up when you're talking to people, and you're like, am I making all this up? Like I feel like I've made everything up, because you've just got all these like tools that become quite implicit. And as an early career therapist, it is very, very common to be really second guessing yourself quite a lot. And, you know, to have like any feedback that you're doing a good job is so, so important early on, because your confidence is a big part of being able to be a therapist. If you can't support yourself in the space, it's really hard to support someone else. So any opportunity that you have to be supported, which is why early careers have so much more, like provs have heaps of supervision, and you know, like we look after our early career guys. They should be. I definitely at PAW, we definitely do, but they should be looked after really, really closely, because it's actually very hard. Has that been similar to your experience, Ash?
Yeah, definitely. Yeah. It's interesting what you're saying there, Sam, about even considering the impact that these dogs are having on us as therapists in the room as well, and how so much of what we're doing is fueled by our sense of being grounded or like confident about what you're doing, you know, because no one's going to feel relaxed if the person who's meant to be driving it is all over the place. And so that impact as well, like there's just so many different things that they have influence on, and it's so amazing.
Even if that was the only thing that they did
for both of you.
Absolutely.
Yeah. They're for both of you.
Mm-hmm.
And what about you, Ash? What in particular have you found helpful with Beanie in your sessions?
Definitely, like, you know, it's obviously a friend of mine because we were just talking about with how she helps to ground and regulate me as well. Even like, you know, I'm lucky to be very well supported with professionals that I check in with regularly, but I'm here alone. So like even just having her to you know, go outside and have a little walk with, like she's amazing for my well-being as well. And but with clients, another thing that I've noticed that is so lovely is, and I know that it's sort of, you know, some therapists are okay with like giving their clients a hug or something. I don't fall on that side. I'm on very much like, you know, clinical, let's protect those boundaries, all of that stuff. But, you know, the dogs can do that ethically. And how amazing is that, you know, just that layer there of providing another sort of sense of support and being held. And it's so cool. There's just like so many little things. Hey, I feel like I should have done a few sessions and like noted all of these little dot points, like all these tiny little nuances as they're happening. But there's just so many moments in my day that I'm like, oh, how nice. Like that would not have gone as smoothly, or, you know, and even the moments that don't go smoothly. Like when I first started with Beanie, I was terrified of the weird things, or like she's had a day in here once where she like vomited in a session, poor thing. She just ate some weird grass. You know, and at first I was like so freaked out about the variables that come with having a dog in the room, even though she's, you know, trained and lovely and does, you know, listens and all that stuff. But even those things are like really good for the therapeutic alliance. It strengthens it because you laugh together, and I guess there's just those moments
It's
of push pull.
forgiving.
It's forgiving, and it kind of
Yeah.
adds so much humanity to the experience without blurring boundaries. Yeah.
That's so funny that you just use that word, because I was literally just thinking, when stuff like that happens, it feels like it really just humanizes you as a therapist, and it breaks down those boundaries and barriers of like what your clients think that therapists have like completely got their shit together, and that couldn't be further from the truth. Couldn't be further
We're
from
all
the
human.
truth. Mate.
Everyone's human.
We're all on a journey.
Yeah.
So I find that, you know, like it really helps to go like, oh, that's just a person, like that's cleaning up dog vomit. Like I can feel so much more comfortable in this space because I have a dog and it vomits, you know, and like Ash is saying, like I don't have to talk about all of the areas of my life that I'm on a journey with, and that I, you know, like the struggles and challenges that I'm having, because that would be inappropriate for me to discuss those kinds of challenges and things like that with a client who's got their own burdens and that they've brought here for us to work through. It's not, sometimes self-disclosure can be really useful, don't get me wrong, like but if you're actively going through something as a therapist, I would say those are the things that you're not going to disclose, because they are still a burden, and you don't want to put that into the space with your client. But when the dog stuff happens, it's like this isn't anyone's. Is no emotional burden or anything like here that we're using to humanize us. It's literally like the dogs just do it, just being a dog, and people can so easily relate to like, oh my goodness, they're like, they just farted in their sleep, or, you know, like something like that.
Yeah.
There's a handful of times in his life where Sonny has done an audible fart and like woken himself up, and like he's like turned and looked at his bum, and I'm like, what?
Checking it out.
This is hilarious. What is happening right now? And he's like, what was that? I'd say like 5 times in his life. Like, it's just hilarious. But yeah, like Ash said, I think it's like funny that you use that word, because I definitely find that it really helps. And we're also doing quite a lot of modeling in that space too. So when we what's actually really important for animal assisted therapists to understand is that the way that you're interacting with your dog in the space, you are modeling yourself as a human being to your client. So you need to be aware of that. And if your dog vomits on the ground and then you panic and get all flustered and all those things, you're modeling that coping strategy to your client, who now will be seeing you as someone who they don't potentially want to fluster, or someone that they feel can't handle them, and all this crazy shit they're going to tell you. Like,
that's true.
Can you hold the space for them if you can't hold the space for a dog that's just vomited on the carpet? Do you know what I mean? It's really important to keep that in mind, because, and we're all people and we're all humans and we all have moments and make mistakes and stuff. But I would be very moved to reflect on that in the space if I was a therapist and I felt like I didn't handle that well. I would probably talk through like, oh, I just got quite flustered then. Like, oh, I'm just going to take a few breaths and it's only vomit. Like, oh, okay, cool. What were we talking about? You know, like that kind of modeling as well, to keep in, you know, just being really self-aware, I think is going to be important if we are having a bit of a wobbly moment.
Yeah, definitely.
Absolutely. Have there been any, like, because you've been working now, Ash, with Beanie for a year, how long did it sort of take for you to really feel settled in as a team?
It's a really good question.
Obviously, there would have been a few little hiccups and, you know.
We moved to this space in early February, and it's a much bigger office than I was working out of previously. And also, just sort of the variables of this building work really well for Beanie, and she's been very, very settled since then. Like, I think it like probably took us just she loved it being here as soon as we got here, and then the sort of adding in those different like she's really, really good with her when we make a boundary. It's one of the things that she's just like quite effortless with. I think it's because she gets the immediate reward of like going through it. You know how there's other things that there's not like this immediate reward attached. But so just sort of setting up those little things about like this is that space, you know, this is there's a like Pilates studio downstairs. So just being like, oh yeah, wait, I know that you want to run down and see everyone, but we're just gonna stay up here, you know, things like that.
Oh, bless.
And once we sort of worked out those physical things here, she just got so relaxed and just really settled into the space really well. Yeah.
Oh, wonderful. So it was really environmental that
Yeah,
helped you both
definitely.
settle in
Yeah.
together.
And I think it's always going to be a bit of that. You know, there's obviously we have such an impact on the dogs as their handlers as well. So when I was feeling more settled into the space and, you know, focusing on my well-being and stuff, like there's that direct correlation there of she's really settling too and feeling really happy. So probably a bit of a yin yang sort of thing there. Yeah.
Do you think, Ash, that, you know, when you took her into the first environment that you were in before you had this space, do you think that getting this opportunity to start fresh in a new space has made a difference, you know, like as opposed to taking her into the first place that you worked together? Is that, you know, because I know that people can get quite a bit of like anxiety bringing the dog into the space initially when they first start working with them. And I wonder, you know, does that, because I changed spaces a lot. By the time I got to my office that I'm in now, I was a pretty confident animal assisted therapist, so, and dog handler. So I think I was able to set that space up. Like I was able to set it up for the dog's well-being. So I built really big rooms in my clinic. Whereas I could have put like 6 rooms in and had normal little psychologist rooms, but I've got 3 really big animal assisted therapy rooms, which cuts your profit obviously immediately in half. But, you know, did you find that? Like, was it easier going into the next space after you'd already had a little bit of experience somewhere else?
Yeah, definitely. I think there's a lot of different factors involved there. There's sort of fewer variables here upstairs. It's like a really quiet environment, and there's other offices here, but I genuinely don't even know when everyone else is working. Like I barely see people. It's very relaxed and very quiet. And so I think that really helped that there wasn't a lot else happening right outside our door. But then also, like you mentioned, Sam, where you're building up your skills in these different places. And so I think naturally just having a few months under my belt of working with her and then coming in as that confident handler, setting everything up so intentionally for a dog and also specifically for Beanie, and bringing that confidence in from the start with that intention was probably really helpful too. Yeah.
Yeah.
And when you say specifically for Beanie, you're talking about the boundaries that you mentioned before, specifically for Beanie.
Yeah. Or even just like her big, which I don't think you can see, but like her big fluffy bed and just the way that I know she likes to, I mean, Sam, you would have educated us within the training about like sort of different stations that the dogs can have in these bigger spaces.
Yeah.
Which is so good, isn't it? Because then it takes so much pressure off you in the session to be like regulating a dog that's not really super relaxed and comfortable as well as doing therapy. Like I don't really need to do any of that. It's like a random day every now and then where the stars align weirdly or something where that's more of a thing. But just sort of being really like getting quite a big couch where I can put her bed, which kind of takes up about half of that couch, even though it's like quite, you know, you can fit 3 or 4 people on there. And so that she can sort of rest with the client, or even behind me, I've got my therapy chair and then I've got like an ottoman next to it. And, you know, I'll put the bed up on that ottoman and usually she's quite settled there as well, which means that I can pat her while I'm she can kind of choose to be right by me, getting sort of just me subconsciously patting her in sessions or with the client, or you know, walking around anywhere else basically. So just those things. I know that she really loves just being patted gently as we're chatting, so things like that.
Yeah.
Oh, yeah. Lovely. Yeah.
We do talk about that quite a bit in the course, because it really does, like, you know, any therapeutic environment should be set up, you know, with all those sorts of things in mind, like for the client's experience of that environment. There's nothing that frustrates me more than finding out, you know, whether it's government spaces or whatever, that is not conducive to what we know is, you know, creates nice environments for clients to be in. It just makes everything harder. Therapy is hard enough. Let's make it as easy as possible every opportunity that we get. And things like setting up spaces is one way to do that. Adding a dog into a space is another way to do that for a large group of clients. Not every client, obviously, wants to be around dogs at all, let alone in a therapy session. So, you know, but absolutely, if anyone's thinking of how they're going to set up an office or something, an office space or something like that, yeah, big couches are a must. Like, there must be enough room for the dog to comfortably get up on the couch, because the clients really, they seek that out, don't they?
Definitely. Yeah, and she's not a tiny dog, so you do really need a big space there.
Absolutely. And I find, like, I work with kids, so we leave quite a lot of floor space in our rooms, because we sit on the floor a lot with the dogs as well. We play games, and we do also they want to play fetch and stuff like that with the dogs as well. So, you know, things like your office space setup are really important. The other thing to take away as well that I forgot to say before is that anyone who hasn't done any training or assessment with their dog and they're already taking them into a workplace, just going back to what Ash was saying about, even after she'd done her training and her dog was graduated, the first space that she went into it's not as good as your second go in your second space. And that's as a graduated handler with all the information. So please be aware that if you haven't done any education yet, don't take your dog. Don't take your dog. I know it sounds easy, and, you know, we've got all these tips and tricks and things, but you're just wait and just wait and get that confidence up, because it really does make such a huge difference. And you're listening to Ash talking about that, even just going from the first workplace to the second workplace.
There's also just so many little things that you wouldn't know if you haven't done the training. Things that you wouldn't even think about. I imagine, Ash, like you're nodding.
I'm like terrified thinking about that. I just can't even imagine. Yeah.
Yeah, all these little details that you can't think off the top of your head. You know, you got to learn from experience.
And you need to understand why. Like, when we do the training, we talk about why. Like, we're just mentioning a few things now, but we're not going into the research and talking about the why. That's what we do during the courses. But understanding the why is what helps you then generalize that information to new and different situations. If you're just rote learning by copying what someone else is doing and not understanding why they're doing that, then in a new and different situation, there's every chance that you're going to get that wrong. You might get it right, but there's every chance you're going to get that wrong. And if you're not understanding, like, it's so hard for us to explain simply why animal assisted therapy works, which is why Ash is saying, like, oh, I don't know, like, that's great. It's just great. It's so hard to really put that into words simply. It's a whole thing. But you can do more harm than good. So, you know, particularly in these spaces where people are vulnerable, you know, Ash is a counsellor, like, people are coming in there and they're vulnerable and they're making themselves more vulnerable. And if Ash is incorporating, you know, a therapeutic modality that she doesn't understand, then there's every chance that could go wrong. And that's exactly what animal assisted therapy is. So that's why we talk about, you know, guys, like, try and get educated. There's plenty of opportunity. You don't have to just train with us. There's plenty of places now that people can do some animal assisted therapy training.
It's also about the problem solving. You know, it's easy to do all those things when things are going right.
Yeah.
But the real difference between training and not training is when everything goes wrong.
Correct.
Yeah.
Absolutely.
And knowing how to handle that. Yeah.
Yeah. And also, sorry,
No, you're right.
not just the clinical stuff that we're learning, but the time that I spent with Beanie to get her up to scratch to be assessed. I spent so much time going over everything in all of these different environments. And not only was that amazing for her understanding and building those tools, but it was amazing for our relationship as well. Like, we built a lot of trust in that time. And there was a really big change between from the start to all of that training and then assessment. So relying on that relationship and that trust as well, I feel like was huge.
That is a huge thing, the relationship, particularly with your dog as the handler. Yeah.
And how do you think, Ash, like, how do you think your clients, can they perceive that? Is that something that's come into the space with you?
Yeah, because I would be nervous. Like, I would be really quite anxious if I didn't feel like she was going to listen to what I was saying, or if I didn't feel like I could correct something within a split second. Or if there was, God forbid, any actual real danger, you know, if like your dog wasn't safe to be around somebody for a specific reason or was going to be spooked or something, like going through that assessment and knowing, sort of clearing out those risks as well, I guess checking those things through to be very sure that that's not going to be a problem, also gave me so much confidence. And yeah, I mean, I'm sure that any therapist has had a day where, well, probably many days that they can remember where they just felt more like on edge or tense or anxious or something like that, got like terrible sleep or something, you know, going through their own stuff. And that foundational energy that you're bringing to the session does change things so much. So if there was any reason to not feel completely comfortable with myself, the space, and Beanie, then it just would not be very good work. Yeah, like, people pick up on that. And that's like, it's just such an important part of therapy, isn't it?
Oh, yeah.
Yeah.
Absolutely. That's cool to hear, that throughout the process of preparing your dog that you know, recognize that you're building that relationship, because we do get people that have done the course and they get stressed during that time, you know, and they start coming back, and like, we offer post-course support and things like that, but they start coming back and kind of getting a little bit grumpy or a bit aggressive even with us because they're finding it hard. And I sort of go like, you know, like, the activities that we set, they're not that hard and you don't have to do it perfectly. But what I'm a little bit concerned about is that you're not okay. So, you know, and that your response to that is actually pointing the finger and getting all upset with me. So, you know, you're not ready. That's what that tells me. And so regardless of, you know, you could get 5 out of 5 on all your obedience assessments, but you're not ready. So I really try and encourage people when they are coming back and saying, like, because it's, you know, like, it is a lot of work. Like Ash said, like, she dedicated a lot of time to it. But we know that you need to do that. Like, there's another thing that, like, see, Ash has figured it out, but like, I know that you guys need to do that because you need to know that dog inside out. You need to have that predictability of their behaviors, and you need to have that level of trust and leadership to be able to work safely with them, to be able to work effectively with them, and for that dog to be able to feel safe and confident and adventurous and curious in that therapeutic environment. They need to have that relationship with you. So if you're already freaking out about, you know, getting the sit or the drop, or, you know, a mat stay happening, there's more there that we need to work on, because it's A, not that difficult, and B, it's a journey. Like, we've removed things like really structured due dates and stuff. Like, we give people so much more time than like we used to back in the day. It used to be like, you know, pretty fast paced. but, you know, we've removed things like due dates and stuff like that so that people can just enjoy the journey. And I think it's so cool when we find people like Ash, who have taken that on board and have really made the most of it. And you can see the outcome is that she's working happily and confidently with a happy and settled dog that has been a benefit to her sessions. And, you know, I know that it's hard to know this when you're not living inside my head, but I do actually know, I do actually know that you need to get to that point to be able to work effectively with your dog and for your dog to be able to be safe working with you. That's why we ask people to, keep working on it. Just keep working on it.
Is the difference, Ash, between before you started, before Therapy Dogs Australia, the difference, what am I saying? Is the difference of the relationship with Beanie quite dramatic? Like the before and after of Therapy Dogs Australia, what sort of changed, or what are the main things that stand out to you that improved your relationship with Beanie?
I think we've always had that really lovely, like, you know, normal or like personal, you know, dog human relationship where she's always been a very happy dog, and very well supported from a personal perspective. I think it just really developed the professional relationship, I guess, and just these different strategies that are so conducive to the professional environment and to therapy. So I think I would have had to be, I mean, she's always been like a good walker and stuff like that, but she's just like I mean, I'm taking advantage of her like border collie brain for sure. Like she's just so onto it with following me, like shadowing me here, which is also a safety thing, isn't it? Like I know that I'm not worried about her like being in a space that she shouldn't be in and all of that stuff. So just kind of these different things that I guess people wouldn't really need to put time into. Like obviously a lot of people really train their dogs regardless of using them in professional spaces, which is very cool. But there wouldn't be that necessity to have these like, like a 10-minute mat stay or the really good sort of shadowing, just different things like that. And also I understand a lot more about her well-being too, which is obviously incredibly rewarding from a personal and professional space. I don't know, it's just like such a fun time. I think I got so lucky with the timing of when I did it because I did do it just after finishing my master's coursework and before starting as a registered counsellor. There's that gap there where you've got to like have your degree mailed to you and all that stuff. So I got so lucky with the time that I was able to put in. I think for a lot of people it would be way harder to pull that off, or it might take a bit longer, which would be a good thing to cover your bases in that way. But I just have such fond memories of that time that we spent together. And so I guess it's pretty hard to pull apart the professional and the personal, but yeah, definitely those like really functional skills that built up my trust in her and probably her trust in me as well. Like she knows that I know what to do in different environments because I've been trained, so I can have her with me in all of these other random public spaces and be really comfortable.
Yeah, well, that's a big standout, isn't it? The difference between personal and professional is noticeable, I think, as well for clients. But that's something maybe that people don't think about when they're going, oh, well, I'm going to have, my dog with me in a session. There's all those little details that, set apart the professional versus the personal relationship with the dog as well.
I'm interested as well, Ash, to know when you started working with Beanie, have there been times during like your time with her in people sessions and just in the workplace and stuff like that you have gone, oh, we talked about this in the course? Like, have there been times where you've gone like, oh, that's something that I learnt about? It's happening. That kind of thing. Like, is the course like, are we hitting those markers, do you think, for that real life stuff?
Yeah, I think a bit of it is kind of what you touched on before, Sam, when you were talking about how you do this stuff for a little while and becomes like this, you're like, which toolkit am I like,
Yeah.
it's all like quite like blending together and things. But yeah, definitely. There's those things, sort of like textbook things that come to mind. And but there's also the practical stuff of spending that time using your methods to teach her to like drop or something.
Mm-hmm.
There's been times where she might be, I don't know if this is a general thing or a Beanie thing. Sometimes she just gets a little bit like, she just kind of wanders around. It's like she doesn't really know where to be.
Yep.
And so using that skill of making, well, like with the mat training, you can essentially make any space their comfort space and their secure. Oh, I love that so much. So that skill of like, this is your space to rest right now, has saved me so many times when she could have just sort of been walking around. And like, there's definitely like, it's fine. She'll spend a couple of minutes walking around sometimes in sessions, which has never been a problem. It's quite entertaining sometimes to see her hands, considering when she wants to lay down. But I just, yeah, if we didn't have that training, I mean, across the board, there would be so many things that I would be really nervous about. But it's just so good to rely on the fact that I can ground her at any time, because I spend so much less time handling her, I guess. Like, I just feel like there would be so much more time out of every client's hour of me just trying to settle her, rather than, we've got that skill from all of this training and all that time working on it, where she's just like, oh yeah, cool, this is my spot. I'm going to hang here and I'm really happy and comfortable. So yeah.
Cool. And like on the other side of that, is there anything that you think that has popped up, or I know what you're saying, like, once you get into the field, you're sort of picking up information from everywhere and it all becomes kind of like just your knowledge base. But I really want the courses to help people feel confident and ready to go into the workplace. And I want to prepare people and their dogs for, you know, whether it's an unexpected event or things that we find pop up a lot, like that. So it's actually an expected event. Like, I talk in the courses about collar grabbing, because I've had kids grab my dog's collars like so many times, things like that. But is there anything that you think that you've come up against in the last year that surprised you, or like that we didn't cover, that we could, start warning people about or preparing the dogs for? Like, has there been anything that you thought like, oh, this would actually be really useful for others to know about?
That's a really good question. I feel like I'm like not well enough positioned to answer it, because I feel like the stuff that Beanie and I want to improve on is probably right there in the course, like it's definitely in there. It's just that we need to do even more of that training, and put more time into different skills.
So what would be those skills? Like, what are the things that you would suggest that others who are training now or in the future, like what do you think are the skills that they should like just take it, they take this part seriously and really put some time into this?
Something that we are working on always, and that I probably will have more questions for you about at some point, Sam, is Beanie, I guess she's a medium-sized dog. She's like just over 20 kilos, and she will jump up on adults. It's really interesting. Like, I remember being really nervous about her ever being around like little humans, like kids and toddlers and stuff. She has this natural, like, it's just never been, I'm always like very on
She's
edge
super
when
gentle
she
with them.
is, just in case, but she's so gentle.
Yeah.
She just does that naturally, which is, thank God, right?
Yeah.
But we, like, my partner, my clients, like, she gets reinforced for that all the time. Like, they're always like, oh, this is so nice, it's a hug, like. And so as much as we're working really hard on, I'll do the like stepping on the her lead thing to keep her not able to jump up and stuff like that. And maybe we need to do more of that. Now that I'm saying it, I'm like, that's the thing that we need to do more of. But yeah, like, I think it's just hard when there's these things that are a lot of people really enjoy, and again, probably from that personal sense, but you just have to sort of try and have better boundaries within the professional side. And yeah. So she definitely gets reinforced with that, where people are like, oh no, it's fine, I'm such a dog person, I love this. And I'm like, I know you're all dog people and you all enjoy this, but I'm like, what about that one person who's not, like, who is a dog person but just doesn't want to be, have the dog's paws up on their,
It's a really
their
good
tummy or something.
it's a really good question, because what does happen then? Like, what has that happened? Has she jumped up on someone who hasn't appreciated it?
Well, I mean, I don't work in spaces where more vulnerable people are coming through, but we would need to take that very, very seriously if we were going to transition to a different space where, for example, there was lots of pregnant people or people with wounds or something. Like, we wouldn't be up to scratch for that sort of environment right now, so we would have to be like full on with the training around that and really reinforcing that. So yeah, just those things, right, where you're just trying to make it as safe as possible.
It's funny you say that, Ash, because I've got a 7-month Groodle, 7-month-old Groodle, and it's the same thing where he just loves people. And just from a personal perspective, it's the same thing where he gets reinforced. He jumps up and people go, oh, it's fine, and they grab his paws. And I'm going, well, actually, he's got to learn, and trying to get him into sit. But it's the exact same thing where people are reinforcing it. He's getting reinforced because people love it, but it's just that one person that I'm always thinking about. He's only halfway through his growth spurt as well. So
this is the thing to consider, ladies. It is important to note, is your dog jumping on people who don't want to be jumped on? Because if they are not doing that, then you might find that those people have invited your dog to jump on them. So keep an eye on it and observe it, because it might be the case that your dog's only jumping on people who want to be jumped on, and they actually aren't jumping on people who don't want to be jumped on. So watch the interactions, become little detectives, and be very observant on the interactions, and see if you can catch those cues. What are those people doing that's inviting your dog up? So that you can start to piece the puzzle together of, so Beanie knows that if you gaze into her eyes lovingly and speak in a high tone, that means that you are DTC, down to cuddle. Maxine got there.
love that.
So funny.
It's actually a part of a therapy dog's job to have that intuition. So we want Beanie to know who those people are, and we want to know if does she already know who those people are that don't want the dog to jump. So the people that don't want the dog to jump will often give off those body language cues, and you need to pick those up. And you need to be able to pick up the cues from the people who are DTC. So if you can do that, then you can support Beanie don't interrupt if the person wants that interaction, because I find the person just finds it so rewarding. And I know what it's like. So Oliver, my border collie, is like that, but he really only jumps on people that he's very, very close to. It's very hard to get him to jump on clients, actually. So, but I know the clients really want him to, because he's very, very soft when he does it, and he's a 20-kilo border collie. He's very, very soft and gentle, and it's very, very it's actually a very nice experience having him on you. And I use the word cuddle, but we don't really correct him for jumping on people, because he's got about 4 people that he jumps on, and they know how to, if they don't want him to jump on them, they know how to get him to not do that. But the kids that I work with really, really they ask him to cuddle. So they really, really want him to jump on them. So whenever it's something like that, just when we have an actual therapy dog, we want to see if do they have intuition? Do they have that sense? And what is it that they're picking up on? So what is it that those humans are doing that may be subconsciously, or subtly inviting Beanie up? And our ultimate goal is that if I can see that this person doesn't want this behavior to happen, can I then stop it from happening? And if I can, then I don't worry about the dog initiating it in those other situations where the person's saying that it's welcomed. It's a little bit left of center of what, quote unquote therapy dog training is about. Like, there are lots of codes and things like that that are like, they must not jump. But when you're actually working in the field of animal assisted therapy and you are actually watching the human animal bond develop in this really natural, organic initiation and reciprocation between your dog and your client, and you're physically in the room and watching and experiencing and using all of your clinical skills to observe and make good judgments about whether or not this interaction is helpful or harmful, I can tell you right now, there's plenty of times that when dogs jump up on someone that wants them to do it, if you were to interrupt that or stop it from happening, you would be rupturing the rapport and you would be dampening the human-animal bond. And that works against everything that we're trying to achieve and everything that, that animal-assisted therapy is. You're dampening all of that and you're slowing the process down. So there does have to be this level of trust that we can have in our dogs as long as they have earned it. So notice I'm not saying to Ash, don't worry about it. I'm saying watch her, observe it, observe the human, observe the dog, and try and piece together the puzzle. Because I dare say that Beanie has actually got some intuition and she's figured it out. Because notice when I say, well, is she jumping on people that don't like it? And Ash is like, like she can't really think of a time that that's happened. Well, that tells me I actually know that every single human being doesn't want to be jumped on by a dog. So that tells me that the dog is not jumping on every single human being. So she must be choosing which humans she's jumping on, and those humans must be giving her some advice about whether or not they will invite that. And I would say that she's listening to that and she's actually got some pretty good therapy dog intuition. That answer your question?
That's great.
More questions than the answer.
I know, I'm like, what a bonus for me. I love this. Yeah, I think that, like, as you're talking about that, Sam, I'm just reflecting on the last year, and I think that she's really developed that that sense that you're talking about, that instinct of like who is up for this and who's not. Yeah, for sure. And even like, this sounds a little weird, but if she's ever been like out in the yard and a little dirty and I decided to put on like white pants or something, like, and I'm giving off those signals of like, no, like she's quite on top of it. And I, obviously she's going to get both from me. So it's really interesting. Yeah, that makes a lot of.
And some little management tips as well. Like, so if you're in this situation and you can see, so like Nala has her little routine, I think I've talked about before, she jumps up on the couch and like tries to put what are the rank, disgusting dog toy she's got in the client's mouth.
In the mouth. Oh,
take it.
She doesn't understand that we have hands because she doesn't have hands. Like, she doesn't really have theory of mind. And she's like, that's her. And I've let her do it since she was a baby because the clients froth on it, mate. They love it. So she climbs up, she jumps up, and she tries to put it in their mouth, and they don't take it in their mouth. So she's like, what? So she climbs along the back of the couch behind them, and they're like wearing her like a scarf. She's a 21 kilo, 2.5-year-old Labrador. And she's like on the back of the couch, and they're like, what's she doing? But she comes back around from the other side and then tries to put the toy back in their mouth from the other side. And depending on the client and how it's going or whatever, I'll either say she thinks that you need to use your mouth with the toy, or like, sometimes I just let it play out and see like, what does the client think is happening? But always she like, either they'll start to like play with the toy with her and she's like, yes, or she just slides down the couch and like gradually, like an avalanche, she's like back on the ground, but her back legs, she always leaves them on the couch because she's like, what legs? Like, what legs do I have? Here I am on the ground. And the clients think it's
that's so
hilarious.
entertaining.
It's so funny. And she does it very consistently at the beginning of 95% of sessions that we have. It doesn't matter if it's the first time she's met you or if she's met you 50 times. She's like, lol, this is how you play with the toy. And she's just must be like, oh, these humans, they don't get it. Like, they don't know how to play. But
I must train them.
I'll try and train them. So I know which clients don't want her to do that. She does not really have that intuition. She will, like, she'll hedge her bet, say. She says that you miss all of the shots you don't take. So she's like, listen, I'm rolling the dice.
She's persistent.
So she really needs me to help her be like, babe, like I don't think this parent is like that DTC. So I think maybe we just like save it for the kid. Because like the parent, sometimes I talk to the parent before the kid comes in. And so I'm like, and they'll be like in their work clothes or whatever. And I'm like some of the parents, like a lot of most of my parents, most people, I've probably got like 5 clients that I will ask her not to do that. And because she's so well trained, I just use my tone of voice. And she knows. And so she'll sort of look at me and I look at her and go, you know, good girl. And she's like, oh, damn. And she'll go and do something else. But if you're not at that point where, like, she's so predictable, she makes it easy for me. So, you know, but if you're not at that point where you can predict it that well, or if, you know, her listening, she is incredibly compliant. So, you know, her listening skills are fantastic. And she's very, very compliant with anything I ask her to do. So if you're not at that stage though, so my job when the client comes into the room is to largely ignore my dog because I don't want to take all the pats and play. I want her to give the pats and play to the other person in the room because that's where the bond needs to build. So if I was concerned that I wasn't going to be able to stop her from doing this thing, when we come into the room, I would start talking to her straight away. So I would be like, hey, Nala, you know, do you want to go and find a toy? And, you know, I would just be really natural about it, but I would start talking to her and giving her eye contact. If I started doing that when a client came into the room, that would distract her from that client and it would put her focus back onto me. And from there, I would ask her either to be in a drop probably beside me where I can keep an eye on her, or I'd pop her on the mat and just do a little mat stay for her. And that would be enough to interrupt her routine that she would go like, oh, because she only ever does it at the beginning of the session. She never ever does it at any other time. So that would be enough to manage that. So if you've got a situation where you can see like, oh, this person probably doesn't want the dog to jump on them or whatever, you can manage it by giving the dog your attention. And most of the time, the dog will often preference the handler over the client. That's why we have to ignore them at the beginning of these sessions so that they don't just totally ignore the client. So, yeah, just give them your attention, talk to them. And if you can just give them a job to do like a mat stay or something like that, and then, you know, you're going to avoid that. But being aware that you don't, if it is the actual client, not like the parent of the client, you don't want to completely rupture the opportunity for the dog to be with them and interacting with them. So if it's jumping up is the problem, usually dogs do that right at the beginning when they're excited. So
that's true.
Yeah, we just get through that first part and distract them through that first part. And then I might even say like, do you mind if Beanie sits next to the couch with you? She just loves sitting on the couch. And the client will always say, oh my gosh, of course. And then I'll just pop the dog up on the couch and give them a little bit of a, you just drop here. And, you know, a little bit of a cue that this is where you're going to be lying down. You'll probably find that there's like, why would she jump on them in the middle of a session? Do you know what I mean? Like it's not, it's one of those things that in this type of environment, if you're in a school or something like that, it's a lot more difficult because you're having a lot more energy going on all the time, and we'd have to be a little bit more we'd have to do things a bit differently. But if you're in a setting like what Ash is in, then you can certainly manage it that way.
Yeah. I think when she was younger, it was more time at the start of the session, and now it's just sort of cutting down, which is lovely. Yeah.
Yeah. Yeah, when they're little and people play with them and they just, get excited and jump
Yeah,
up.
that's where Dougie's at the moment. I mean, he's only 7 months old. Yeah,
Yes.
but he does try his best to listen as best he can.
Aw,
So
fun time.
he's doing well.
Mm.
Yeah. Oh.
Very good,
Well,
ladies.
Well, that's very interesting. Thank you, Sam. I feel like there was a little dog training side tip there.
It's all important part of your handling as an animal assisted handler to be able to manage that without. So what we're trying to, like, the cute clues that are in there are about don't rupture the bond, and the dog's you gotta give them space to do their job too. So let's just find out first, are they doing their job? And if we need to help them, how can we help them with management strategies so that we're not rupturing relationship and, restricting their access to the client and things like that. It's so different to, like, if you're just training a pet dog, you just correct it or, whichever way you choose to manage it. But when you're, in the workplace and this dog is working as a therapy dog, then there are definitely specific strategies that I would recommend, like the ones we just discussed.
Have there been, Ash, any moments that Beanie has surprised you? I know we've definitely touched on a few things, but any come to mind where she did have certain intuition, or moments where you just went, "Oh, go Beanie, nice work." That was
Oh my
good
gosh,
timing.
yes. So many. Literally, I'm like, my job is so easy. I don't have to, I don't regulate anyone
just
anymore.
Leave the room.
I'll be back in an hour, guys.
Just going to teach Beanie how to use the FPOS machine and we're sweet.
Seriously, yeah, I'm at the point, feedback is incredibly important to me. And so I'll be sending people surveys to check in about if there's anything we need to adjust. And it's all just like, I love Beanie. It's I just want more time with Beanie, it's like nothing.
Amazing.
But she doesn't do this 100% of the time. Like, she's definitely not a perfect dog and she spends a lot of time sleeping, but she's so good at picking up those. They're just so in tune with emotional stuff. Hey, like, it's not something that we teach them, right? That's the dog thing that they have or they don't have. And then just those moments where, yeah, someone's really, really upset and maybe they'll like start crying, or that there's just a lot, their breathing changes or something, and she can be so attentive to those little things. And yeah, she'll go up and put her head on their lap or like put her head on their feet or something. Like, it's just so sweet. And so for them to just feel so held in those moments, and to have that, to have her there to help regulate and just get through those really tough moments is so incredible, especially with all of the stuff that we know about how important that environment and that safety is. So it just all really makes sense, doesn't it? It clicks in together so beautifully.
It really does.
What about you, Sam?
With my dogs, so mine are a little bit, so like Oliver, my border collie, is far more in tune than my Labradors. My labs are a bit more sort of, are you playing with me or am I just sleeping? So they're pretty good at, if someone like reciprocates their invitation to play, they're pretty good with that. But they're also really good at, like, if someone's doesn't want to play with them, they're really good at, just, that's fine. They can just still they just relax in this space, which I think is super important, that they don't just keep hassling them to play. But it does mean, like, so it means also my social skills interventions, like some of my kids, they don't understand quite like what initiation of play is. And so they don't reciprocate when the dogs do initiate. And then the dogs just exit stage left and go to sleep. So it creates a cool scenario for me to go like, did you notice that Nala asked you to play? because then they'll be like, why isn't the dog playing with me? It's actually because they didn't reciprocate when she asked them to play. So she thinks that they don't want to play with her.
Wow.
But I was just thinking about, because I was just looking out the window at all my horses, and I'm working at the moment with a young person with one of my horses, and I am involving a horse trainer in the sessions as well, because we're working through a bit of we're breaking a horse in, basically, with a client, a very, very disadvantaged, at-risk young person. So I was speaking to the horse trainer, obviously, because we obviously need to, come up with a plan for the sessions and stuff like that. And I was giving her some feedback about some of the stuff that she was sharing about, the horse training side of things in the previous session. And she was like, oh, wow, like you don't realize, like, it's so connected, like the way that horses are learning, and like the way that, because I was saying, like, when you said this is really useful for that client because of this. And so, like, her job basically at the moment is guiding us through. So I'm not experienced enough to take a client through breaking in a horse. So she's guiding us through that stuff, but she's so, like, she's explaining how the horse is learning and what the horse is experiencing and stuff like that. And then I'm using those as metaphors, to help that young person understand those things that they're learning and those things that they're going through and stuff like that.
Wow.
So it's this really, like, cool dynamic of these, like, sort of metaphors that are playing out. And she was like, yesterday, she was like, oh, it's like, it's so cool how it's like there's all this crossover. And I'm like, yeah, like, that's why we're doing.
It's amazing.
That's what animal assisted therapy is. Like, that's what we're literally what we're doing, what we're working on. So, like, this horse that I've chosen, like, I just happen to have this horse and I just happen to have this client, and they just happen to be the right fit. I don't know if I could have ever orchestrated something like this by design, but it just happened about. And this horse, one of the strategies that we use to get them feeling brave around some of the equipment that we're going to start touching them with and stuff is we get them to chase, you move away from them with it. And so the horse, because he's curious, he's young, so he's walking towards it. And as he's coming towards it, they feel brave because that thing is, like, moving away from them, right? So it makes them feel brave. So we've got the saddle pad and you're moving away, and the horse feels brave because they're, like, chasing. But we've discovered that the horse likes to hunt things now. So he really enjoyed that game. But like, now he's started hunting us. So so he's developed this, like, so now when you're walking him, if you're in front of him, he starts to, like, chase, and he bit the trainer on the back last session. Which was hilarious because, like, just nipped her. It was hilarious because I was like, he's going to bite you. Like, because I was watching and he bit it. And the client thought it was hilarious. The client's got a very, he's a teenage boy. He's got a very violent, aggressive tendencies himself. So to see, like, that this behavior sort of played out and that sort of thing, like, it's become so useful because now we're like, okay, so now we know. We've taught him this game and he really likes it, and we like that he likes it because he's feeling confident and he's feeling brave, and we're going to want those skills in him when he's under saddle. So we're going to want him to feel he might be a great mustering, he might be a good cow horse, or he might be good at some of the games, the ridden games where you chase balls and stuff. So we want to keep this trait, this confidence that he has, but we do want him to understand that he can't bite people and he can't hunt people. So we're working on, like, attending and, making sure that we're doing our personal space boundaries, and we're talking about, making sure that he understands that it's just a behavior. Like, it's not that this is a bad horse and we're going to bush it. Like, that's not bad. It's a behavior, and it's a behavior that worked for him because it made him feel good about the saddle pad. But we need to understand that that's not for humans, that's for games, and we'll let you know when we're playing that game, sort of thing. So the metaphors and the things that are coming around about that, they're so rich around, behavior and, separating behavior from you, and
Yeah.
setting boundaries and, personal space boundaries and things like that. And because this horse is so beautiful and safe and things like that, this young person is working on holding the lead. And if he's coming into your space, you move him back out of your space and things like that. And it's like that horse in particular is like what we're saying about the dogs, like that intuition and stuff like that. He's very connected, very, very connected to this young person. And it's become a real theme of they're both a little bit naughty. So it's a real theme that we've got going on. They're in cahoots with each
beautiful.
other. It's very beautiful. And so that there's a lot of human animal bond that's developed there. And it might sound like, oh, cool. But this is a young person that really can't go anywhere or do anything else because they're not welcome, or they refuse to go, or, things like that. So it's a pretty important thing that we're able to have this relationship, because that's what's keeping him coming to his sessions. And it was a very important thing that I was able to involve another human being the horse trainer in the sessions, because that's where things could have gone pear-shaped as well. But because of the relationship that I'd already built with the young person with the horse, so I'd already started out like the really easy stuff with the young person and the horse, and then I was like, I think we could take this further. So let's do this for real. So when like that relationship that he already had with the horse, that relationship and the buffer there is what allowed the next human in. Does that make sense? So he hasn't had any, and this is a very, very challenging behavior, young person. We haven't had any challenging behavior towards this new human being who's now here.
Wow.
That's like never happened before. Like, but it's because of this relationship that, and also she's, her and I are very similar style as well of a human being, but also trainer, in that we're very centered around like, what is the animal's experience of this, and how can we, make sure we're challenging this animal, but, they're learning, but we're supporting them through that process of learning as much as possible. And he's learning about the body language and all these things. And so the other thing is this horse is stoic. So he pretends that everything's fine, but he's catatonic basically. So he just lets things pile up, and then he'll eventually get upset, which I learned by myself with him when I put a rug on him for the first time and he nearly died. So I was like, whoa, okay, you're like pretending to be cool. But we like know that with this horse now, right? So right at the beginning of the session that I had this morning, I sent the kid in to go and get him out of the yard. He's got to, get him involved. And the horse was like, oh, I'm really busy, and just like took a drink of water. Like when he went in there, I'm like, we're making a joke of like how he's like, oh, he's so busy, like he can't come out and get work today because he's really very busy.
He's so busy.
much going on.
So much going on. I'm just like, got to drink this whole bucket of water, And
really busy schedule.
One of the things that horses will do is they'll do that, but like if they get tense, they'll hold their breath sort of thing, and they just sort of tense. So he's holding the water in his mouth, and like me and the trainer, like we know he's doing it because, we've seen stuff like that before. But so we walk out and we're like making these jokes about how busy he is and he's got to drink this water and this stuff. And I said, he's gonna spit all that out. So just you watch out, because this kid's averse to like that sort of thing. I see he's just hanging on to it. He wasn't even thirsty. He's just hanging on to all that water in his mouth. He's just going to spit it out. And it took a good couple of minutes, and he's like dribbling a little bit. This kid's like, ah! And then eventually, after a couple of minutes, he let all the water out of his mouth, just like dropped it all on the ground. But during that time, we had started talking about like one of the things, and what we already know about this horse is that he pretends he's cool. He pretends everything's cool, but he actually is a bit more anxious than what he lets on. He is a bit more tightly wound than what he lets on. And we had talked about, they tense everything up. And so we'll know that he's relaxed because he'll drop the water. And then he dropped the water. And so it's like this really cool visual thing of like, we just walked into the round yard and we're just just chatting and waiting and, that sort of stuff. And then he eventually drops the water, and it just really builds this like visual thing. And like, the metaphor is building and building every session around, you know, the stoicness that this horse has, which is what this young person has too, is I'm fine, but you're not fine, and neither of you are fine. And we need to scaffold things. And if we didn't know like about these, you know, certain behaviors and things that horses do and stuff like that, we didn't like, we're waiting. I'm actually just waiting for him to drop the water because I know he's holding it in his mouth, you know, like, so, and we know that we need to just be quiet and wait, and that's okay. And, you know, when he starts to regulate himself, and because we're regulated and then he's co-regulating off of that, it's so cool for a you know, challenging young person he's very difficult to engage in any other type of therapy without.
Wow.
Yeah. So that kind of thing, like, it's very, very cool. And it's knowing your animals too, and knowing like, you know, I've involved obviously a more experienced horse person to help us on this, you know, process as well, to really make the most of it. And it's not the type of thing that, you know, every client needs, obviously, or that you know, it's a pretty hard situation to provide. Like that's a fresh out of the wild 6-month Brumby. Like it's, you know, you don't come across those opportunities that often, but when you do, like knowing how to make the most of these types of scenarios as they do come about, like it's pretty cool when you get experience enough to go like, oh wow, like I think this is something that we could really do here. And that horse and that kid are very connected. And I see a lot of intuition happening with that horse. And he does lots of really funny things. Like the trainer was asking him to, like trying to send him out in a circle on a direction he doesn't like to go. And he like just runs straight over to the young person. He does stuff like that.
So sweet.
And we're like, oh, you too, you know, like,
Yeah.
it's very cute. The horse is very, it's a bit special, really. So, yes.
So special.
It is so special. But when you get opportunities like that, which they come about from time to time, you know, we've also got to consider what we're going to do if and when that relationship needs to change or come to an end or things like that. It's a pretty big scenario to be in. You know, like if a young person, especially, that's so difficult to work with, like that young person is, it's pretty challenging. But he's been on my books for 7 years. So we've built a fair bit of consistency and trust in the therapeutic relationship. So I'm hoping that we can piggyback off of that and we can allow ourselves to feel vulnerable in this new relationship with this horse. So
that's amazing.
Yes, that's a whole other podcast, is what to do. What do we do now that we've got this connection really happening? And is that something that you've considered and thought about as well, Ash? Because you're talking about, you know, your clients are like feeling very connected to your dog, and it's like, what now?
Oh, I can barely bear when she's got like a vet appointment that day. You know, she can't come in. That's already like really sad sometimes. Yeah. I mean, for personal reasons, I can't let myself really think about like if anything was to happen to her, because I'll just have my own, you know. That is such a thing though. I'm grateful I haven't really had to contend with it yet. And I imagine that you would have to think through a lot of it, and do a lot of, I mean, if you were able to do a lot of like intentional time before that was changing. Yeah.
So like if you're thinking about coming to the end of like a treatment block or whatever, you know, like that kind of thing, which in counseling is probably a little bit different to psychology. And the psychology space has changed a little bit lately anyway, where people have got more mental health care plan sessions, but traditionally people have got 10 Medicare rebates to use in a year. And at the end of that 10 is when they would usually disengage. So they don't have to pay full fee. And then we're looking at like what relationship has built in that time, and how are we preparing for that to come to an end. Or people that work in government type settings and they've got like time limits and stuff. Like I'm in private practice and so are you, Ash. So like the client can make more of those decisions about when they're going to need less of both of you, and sort of taper off. But yeah, like obviously, there can be unforeseen circumstances where we, can't have the animal around anymore.
Yeah.
Whole nother podcast.
I was just about to say.
Whole other breakdown.
Whole other thing.
Yeah, you're right. Like I think counseling definitely is a lot more relaxed in a few ways, which I'm grateful for, because you've got to be very, very across things. I mean, always in both, but yeah, it's more there. I guess there's sort of more of that, like, oh well, you can come back if you need to, so
Yeah.
less of the like big goodbye. Yeah.
Yes.
Yeah. I'm conscious we don't want to keep you too much longer, Ash, but I did want to just quickly ask as well, is there anything for those listening who might be studying at the moment with Therapy Dogs Australia, or training their dog, or studying counselling or psychology, is there anything that you have now learnt with the experience that you've got with Beanie? Is there anything that you didn't realise was going to be so important when you were training Beanie that now comes into play in your everyday practice with your clients? Or is there anything that you came out and now you're working and you've gone, oh wow, like I didn't realize how much this was going to be involved in my practice? Or is there anything like that that you can think of that people studying might be interested in?
I think I'm a bit of a broken record talking about this, but it really is just a huge thing for me, where when I was studying, I mean, they did educate us a lot about, like, the environment, the relationship, safety, rapport, all of that stuff. That was such a huge part of my degree. But I think as a new counselor, like through my year of placement and then like in my early practicing months, and with that imposter syndrome that like probably doesn't go away, would love that. But like in those early stages, I was so focused on the modalities and like the textbook stuff, and like going through things like as they've been researched and taught, and just really relying on the all of that industry behind me. And obviously, like as I've gone through, there's more of that intuition and more instinct and more like blending things together and stuff. But just the biggest thing I just feel is the environment and the relationship. And I guess they couldn't have really just taught us that through a lecture on, within the degree. So I guess it makes sense that I've learned that so much through practice, and I've seen people and their body language and their the way that they're able to work through something, or just all of these different things. Like I've just spent so much time with Beanie in this space now that I can just see the difference so clearly. And yeah, so I guess like that environment relationship stuff, that it's just cracked through, adding so much humanness to the interaction, is just really surprised me. And yeah, it's all so interwoven. Like I feel like I can't pull it apart, because you don't get that if you are going into that room feeling anxious about what the dog's going to do, or if you don't really know what to do, you don't get that, you'd be on edge. So it's just all of these different things. But yeah, it's just so important, and changes so much of the feeling in the room. I think you obviously, like, I have spent time counseling without Beanie as well, like just on, some days where she couldn't come in, or through my placement and things like that. And you can build this, obviously. Like it would be pretty awful, wouldn't it, if like no human could build that rapport in that environment and stuff, unless they had a therapy dog. We'd have to like there'd be a lot less on offer, I guess. But I just feel like it adds such a quality to it that a human could not bring, obviously. And also, on another note, it feels like it really just speeds it up so much too. Kind of starts happening a lot sooner than in times where there's been no dog involved.
Absolutely.
You agree, Sam? Yeah.
Yeah. It's like, yeah, absolutely. Yes.
Oh, well, thank you so much, Ash, for chatting with us this morning.
Yes. Thank you for your time, lovely Ash, and your lovely insights. It's always good to speak to.
So
Good. We might have to get you back again. We'll start deep diving into some of those other topics.
Oh, we were touching on some good topics.
We've created some real mess for ourselves here. Oh my goodness!
I'm not going to be able to get that picture of the horse letting the water out of his mouth out of my head anytime soon. I think that's just such a beautiful metaphor for like feeling safe, right? Like how beautiful. I can't wait to hear more about that and your other
yeah. And funny because it was like escaping by dribble without him letting it go. And so I'm like, I know it's in there.
It's in there.
Such a metaphor.
And so cool as well. Actually, I'll just quickly touch on the fact that both myself, who owns the horse, and the trainer who knows this horse but also knows horses, was able to communicate to the young person, this is the behavior that we're going to see. That's really cool modeling as well. That's not to be, underestimated, that for that young person who has a connection with this horse, I know that they've got a connection. Sometimes they just lose themselves with each other and they just stand together for minutes and minutes and I just leave them. So for that young person to know that we know and understand his favorite horse so well, and we are knowing and understanding how to support his new little best friend so well and teaching him how to do that, that's a lot to say for all of that modeling and things that are happening as well. So when I say to you that the way that you interact with your dogs in your sessions, they are watching you. They're watching that. And that's why we won't send dogs and handlers into sessions that aren't ready, because your client is watching you and they're learning so much from that. And like you've heard Ash talking about, the clients love the dog. They love that dog. So if they think that, if they get some idea in their mind, like if I had to just rush through things, first of all, wouldn't be taking every opportunity that pops up, because you don't know the dog well enough and you're not, as you know, like Ash has talked about, like being that grounded and settled and having that confidence. You're not going to get as many opportunities to do as much. Like if I don't know that horse is going to do that sort of stuff, then we can't use it. But the other thing is that, if the client, the person that we're working with, if they think that their little friend that they love is not being appropriately supported by you, that's going to be an issue. That's going to be a real rupture, and I would say quite damaging. So let's stay positive, but also be aware that probably the positive way to finish that note is everyone who has put the work in and, gotten to the place where someone like Ash has gotten to in just a year, should be very proud of yourselves. And please know that there is more that is going on than probably you even realize, that, your hard work really is paying off. And the more that we have these conversations, which is why we're doing this, the more that we have these conversations and the more we break these things down, the more we learn about what we're doing and the more useful we can be and the more we can put our tools to use as well. And the better the outcomes, the better the rapport, the better the attachments are going to be. So please be encouraged. And everyone who's just starting their journey or is still on their journey, or even if you're having a hard time, please be encouraged by this. Not discouraged. All right, ladies, thank you so much.
Thank you.
Thank you for having
Ash.
me.
Thanks, Sam.
Legends. We'll chat again.
Thanks for listening to the podcast. If you're interested in studying with Therapy Dogs Australia, or you have a few more questions before deciding, please get in touch with us by emailing courses@therapydog.com.au or visiting our website at www.therapydog.com.au for more information and FAQs.